This is a general disclaimer. Redlands Community College attempts to have the most accurate and up-to-date information listed in its content and delivery. However, your education is your responsibility. Redlands Community College or Roy Smith makes no guarantee in the accuracy of this information in this video and accepts no liability for the informational video. The information expressed is strictly the opinion of the author and the presenter, which is listed in the reference near the end of the video. This information is designed to supplement your own education or initial education and should not be used to replace any current academic program you're enrolled in. View the information and content at your own risk. Thank you. Alright, this is going to be Chapter 8, Therapeutic Drug Classifications, Part 2. And in this section we're going to talk about these drugs from antithyroid drugs to vitamins. Antithyroid drugs, mechanism of action, inhibit the production of thyroid hormones by the thyroid gland, and these would be given for people who would have a tendency to go into thyroid storm or have hyperthyroidism. Contraindications, patients who are lactating, drugs could cause hypothyroidism in the infant. As far as EMS considerations go, use of antithyroid drugs and caution with cardiovascular disease. Adverse side effects can be CNS, headache, drowsiness, vertigo, and depression, and then epigastric pain, taste loss, nausea, and vomiting. Antiviral drugs, mechanism of action. A virus must enter living cells to reproduce and grow. These are enzymes that are unique to viruses. Drugs have been deployed to prevent penetration of viruses in the cell. Other drugs have been deployed that inhibit enzymes needed for DNA synthesis, so it stops the proliferation of the virus. EMS considerations on this are none. Barbiturates, mechanism of action, produces CNS depression, mimics the inhibition activity of the neurotransmitter gamma-aminobenzoic acid on nerve synapses. Now, this is the same mechanism. Barbiturates give kind of a CNS depressant. An example of this would be phenobarb for seizures. Indications: sedation, hypnotic, anticonvulsant, and for the control of acute convulsive conditions. Contraindications: hypersensitivity, severe trauma, pulmonary disease, and uncontrolled diabetes. EMS considerations: monitor closely for correct flow rate. Rapid injection may cause respiratory depression, difficulty breathing, or dyspnea and shock. Beta-adrenergic blocking drugs, mechanism of action. Commonly reversibility with beta-adrenergic receptors to block the response to the sympathetic nerve impulse. Now, this is going to be the beta site on those adrenergic receptor sites, and what this is going to do is we have selective and non-selective. The beta-2 also is the site that we use to stimulate for bronchial dilation. So the non-selective version of these that block both sites isn't exactly the best choice whenever we're dealing with somebody that has asthma or COPD. So more selectivity, where we're only blocking the beta-1, would be better. Contraindication: bradycardias, high-degree AV blocks. If the heart already has a physical block present, why would we want to slow it down more? Pump failure or cardiogenic shock. Congestive heart failure, unless secondary to tachydysrhythmias or fast heart rates, and that's what these would be for. Chronic bronchitis, bronchial asthma, emphysema, or severe COPD. Now, higher doses of even the selective tend to give us a non-selective version, which would be both beta-1 and beta-2. So caution should be taken whenever people have a bronchospasm in their history of any sort. EMS considerations: monitor the heart rate and blood pressure, and monitor for difficulty breathing, CHF. In the diabetic, monitor for symptoms of hypoglycemia. Calcium channel blocker drugs. Mechanism of action: inhibits the influx of calcium through the cell membrane, which results in a depression of automaticity and conduction velocity in both smooth muscle and cardiac muscle. Now, whenever we talked about the von Williams classifications earlier, the calcium channels were in the middle of the cardiac cycle from 1 to 3, and we got an influx of calcium, so it made the actual contraction stronger. Now, these calcium drugs provide us control over fast heart rates that would be generated from the AV node, and we'll talk about that more in cardiac. An example of this would be AFib with RVR, or A-flutter. Indications on this: would be chronic stable angina, vasospasm, and these more specifically are to elicit vasodilation. So calcium is also required for muscle contraction, and that includes smooth muscle. So let's say that these were vessels, and the smooth muscle in there essentially constricts the vessels or dilates them out. So in the calcium channel blocker drug, what this would do is this would slow down or retard the calcium channels in that contraction, thereby relaxing the muscle. This would work on the vasomotor centers. Contraindication, sick sinus syndrome, AV blocks except with the functioning pacemaker. And as far as EMS considerations, there are none. Calcium salts. Mechanism of action is supplement the patient in need of additional calcium. Calcium channel blocker overdose. If they were hyperkalemic, we give them calcium. So indications on this are hypocalcemia or magnesium poisoning are the ones that the book suggested. Contraindications, renal or cardiac disease. EMS considerations, administer slowly, monitor for bradycardia and hypotension and cardiac arrhythmias. Do not mix calcium salts with any other drug in the IV line. They kind of have untoward effects, and they'll make nice little precipitates that could give the patient an embolism. Cardiac glycosides. Mechanism of action increases the force and velocity of the myocardial contraction, and it gives us a positive inotropic effect or makes the heart beat harder. This occurs by increasing the refractory period of the AV node and increasing total peripheral resistance. Indications on this is going to be CHF, rapid ventricular rates caused by atrial flutter, atrial fibrillation, or PSVT. A cardiac glycoside would be a drug like digoxin. Contraindications, digitoxicity, VFib, or tachycardia. EMS considerations are going to be none. Cephalosporins, this is going to be a multi-spectrum antibiotic. Interfere with the final step of formation of the bacterial cell wall, resulting in an unstable cell membrane. They also cause an inhibition of cell growth and division. Contraindications on this are going to be hypersensitivity to cephalosporin or any other related antibiotic. EMS considerations, infused too rapidly may cause pain and irritation at the site of infusion. Watch for hypersensitivity as well on this. Cholinergic blocking drugs. So cholinergic is another word for parasympathetic. So we have sympathetic and parasympathetic. And in those two definitions, sympathetic and parasympathetic, for the sympathetic we have adrenergic. And for the parasympathetic we have cholinergics. So any one of those words can be used. So these are cholinergic blocking or parasympathetic blocking drugs. Indications for this: prevents this mechanism of action, prevents acetylcholine from combining with receptors on the postganglionic parasympathetic nerve terminal, which would decrease parasympathetic tone and the availability of parasympathetic neurotransmitters. Contraindications: patients with glaucoma, tachycardia, myocardial ischemia, and unstable cardiovascular states. We use this for bradycardia, and if we have other medicines in this as well, but we're going to have to take a look at the individual drugs, as each one of them are used for something a little different. Atrovent would be another cholinergic blocking agent, used for a different reason. The cholinergic nervous system, or the parasympathetic nervous system, is what generally initiates. It is what initiates a bronchospasm. EMS considerations on this: monitor EKG vital signs and assess the patient for hemodynamic changes and intraventricular blocks. Corticosteroids, mechanism of action: adrenal hormones that influence many metabolic pathways and processes in all organ systems. Carbohydrate metabolism, protein metabolism, fat metabolism, and water and electrolyte balance. And these are produced by your adrenal glands. We have glucocorticoids on the truck. Indications for them is a steroid crosses right across the cellular membrane and decreases the effectiveness of your immune system. And this kind of decreases the amount of cellular mediated response we have. Now, indications for this is an anti-inflammatory or immunosuppressant therapy. Contraindications, CHF is what that's supposed to be, cardiac disease, hypertension, wide-angle glaucoma, patients with any type of infection, and more along the lines of sepsis. EMS considerations are none. Loop diuretics. Mechanism of action: inhibits reabsorption of sodium and chloride in the proximal and distal tubules of the loop of Henle. Now, a loop diuretic essentially puts sodium out and the water will follow. Indications for this are going to be CHF, and then we're going to take a specific look at the individual drugs. Contraindication: hypersensitivity and severe electrolyte depletion. An example of one of these drugs would be Lasix or furosemide, and it is potassium depleting. So anybody that would have low potassium levels, they might not have enough potassium to facilitate the utilization of Lasix. EMS considerations: hyponatremia, water intoxication, metabolic acidosis, metabolic alkalosis, hypokalemia, and hyperkalemia, and we'll talk about those in the individual cases and the individual drugs. Diuretics, thiazides, mechanism of action: decreases the rate of sodium and chloride reabsorption by the distal renal tubule. Indications for this is to treat edema and congestive heart failure and hypertension. Contraindication: if you have any kind of impaired renal function, might not be the drug of choice because your distal convoluted tubule is not going to be working appropriately. Advanced hepatic cirrhosis. EMS considerations: determine the extent of any edema by assessing skin turgor, mucous membranes, extremity, and lung fields. If we have edema floating into the lung tissues, or pulmonary edema, that would be from left ventricular failure. Estrogens, mechanism of action: combine with the receptor in the cytoplasm and increase protein synthesis. Estrogens aid in bone maintenance, increase elastic elements in the skin, cause sodium and fluid retention, and keep plasma cholesterol at a lower level. Indications on this would be hormone replacement therapy for postmenopausal women or after their hormones kind of wane off. Contraindications: breast, genital, or any other estrogen-dependent cancers. EMS considerations on this are going to be none. Histamine 2 antagonist, a mechanism of action: competitive blocker of histamine, inhibits all phases of gastric acid secretions. Now, H2 blockers are what we generally see like from Zantac and Pepcid and things like that. Indications: reduce both daytime and nighttime gastric acid secretions, and that would be, take a look at the individual drugs. Contraindications would be hypersensitivity to the drugs, and we generally don't use these in EMS. Laxatives, mechanism of action: act by either stimulating the smooth muscles of the bowel or by changing the consistency of the stools. Now, one of the easy ways to give a laxative is to give something that has a larger molecule in it. It'll pull fluid towards it, thereby adding more fluid to the bowel and kind of putting it on the fast chute out. Indications: short-term treatment of constipation. Contraindications: undiagnosed abdominal pain, which may rupture bowel or cause intestinal hemorrhage and appendicitis or intestinal obstruction. And the EMS consideration on this is none. So no laxatives whenever you have a possible almost bursting appendix. Narcotic analgesics, mechanism of action: attaches to a specific receptor in the central nervous system, resulting in diminished transmission of pain and pulses as well as respiratory depression. This is going to be things like morphine, opiates, Dilaudid. Indication on this is going to be pain, myocardial infarctions, burns, postpartum pain. Contraindications: asthma, emphysema, convulsive states, diabetic acidosis, and obesity. EMS considerations: baseline vital signs. Do not administer when respiratory rates are less than 12 or the systolic blood pressure is less than 90 millimeters of mercury. Some of these are vasoactive. The patient may experience a warm flushing feeling when therapeutic doses are given. Narcotic antagonist, and the difference between an agonist and an antagonist is an antagonist is kind of a blocking. Mechanism of action on this: block the action of narcotic analgesics by displacing them from their receptor sites or by preventing narcotics from attaching to the opiate receptor. EMS considerations: determine the cause of the respiratory depression and observe for withdrawal symptoms or airway obstruction. Neuromuscular blocking drug. These are going to be long-term paralytics, like 20-30 minutes instead of succinylcholine. Let's talk about the mechanism of action on this. Things like Pavilon and Vecuronium. Mechanism of action: compete with acetylcholine for receptor sites in the muscle cells, causing paralysis. Paralysis occurs in the following order: eyelids, difficulty in swallowing and talking, weakening of the extremities and neck, followed by relaxation of the trunk and spine. Indication: management of airway control will use these drugs to facilitate intubations or keep them down for long periods of time. Contraindications: any kind of hypersensitivity to the drug. And EMS considerations: vital signs and respiratory status. Nonsteroidal anti-inflammatories. Mechanism of action: work by decreasing prostaglandin synthesis. Their anti-inflammatory effects are similar to aspirin, and these are NSAIDs, things like Motrin, Tylenol, things like that. Indications: treat inflammation, arthritis, gout, and other musculoskeletal diseases. Contraindication: hypersensitivity to any aspirin or persons under the age of 14. EMS considerations: hypersensitivity reactions to aspirins, NSAIDs exacerbate asthma. Penicillins. Mechanism of action: kill bacteria by binding to their cytoplasmic membranes, inhibiting cell wall synthesis. So this right here does not allow the cell wall to synthesize or generate itself. Indications: gram-positive, gram-negative, and anaerobic organisms. This is an antibiotic. Contraindications would be anybody that's allergic to it or hypersensitive. EMS considerations: IV administration may cause local irritation. Please inject slowly. Skeletal muscle relaxants, central acting. Mechanism of action on this: decrease muscle tone and involuntary movement and depresses spinal polysynaptic reflexes. Indication: musculoskeletal and neurological disorders associated with muscle spasms. Muscle spasms caused by trauma and inflammation. Some people may be on these: flexural somas. Precautions: use with caution in patients with decreased liver or renal function. And the EMS considerations on this are none. Sympathomimetic drugs, or I mimic the sympathetic nervous system drugs. Mechanism of action: act by mimicking the action of norepinephrine or epinephrine, which are adrenergic neurotransmitters that are in our body, produced by the adrenal gland, by combining with alpha or beta receptors, or by causing the release of natural neurohormones from their storage sites at the nerve terminals. Indications: and that would be C, individual drugs, and we have a multitude of drugs that does this. We'll be talking about them starting with Chapter 9. Contraindications: if they're tachycardia or heart block caused by digitalis toxicity. EMS considerations: we should do vital signs, EKG, check their cough and sputum production. Tetracyclines. Mechanism of action: they inhibit protein synthesis by binding to rhizomal 50 subunits. Indications on this: sexually transmittable diseases. It's an alternative to penicillin. Contraindications will be somebody that's hypersensitive to it. And the EMS considerations: administer IM in large muscle mass to avoid extravasation into subcutaneous or fat tissue. So we'd like it in a large muscle mass, and we don't want it into the actual adipose tissues. Theophylline derivatives. An example of this is going to be aminophylline. Stimulates the CNS, relaxes bronchial smooth muscle and pulmonary blood vessels, produces diuresis, and increases the rate and force of cardiac contractions. Indications on this are going to be prophylaxis in the treatment of bronchial asthma, reversible bronchospasm with chronic bronchitis, emphysema, and COPD. Contraindications: hypotension, coronary artery disease, or angina pectoris. This kind of increases your sensitivity to your own catecholamines or your own neurotransmitters. EMS considerations: observe for signs of toxicity, nausea, irritability, and cardiac dysrhythmias. Thyroid drugs, mechanism of action. Thyroid hormones regulate growth, control protein synthesis, and regulate energy metabolism. Indications: hypothyroidism, replacement or supplement. So if they remove someone's thyroid because it was malfunctioning and they don't have a thyroid gland anymore, the easiest thing to do is to give them something like Synthroid, and that's an example of this drug. Contraindications: uncorrected adrenal insufficiency or hyperthyroidism, or acute myocardial infarction. EMS considerations: coronary artery disease, monitor vital signs and cardiac arrhythmias, and report if heart rate is greater than 100 beats per minute. Tranquilizers, antimanic, and hypnotics. Mechanism of action are thought to affect the limbic system and reticular formation to reduce anxiety by increasing or facilitating the inhibitory neurotransmitter activity of GABA, or gamma-aminobenzoic acid. Indications on this are going to be anti-anxiety agents, hypnotics, anticonvulsants, and muscle relaxants. Contraindications: hypersensitivity, narrow-angle glaucoma, treatment for psychiatric disorders. EMS consideration: monitor blood pressure before and after administration. Vitamins: essential non-caloric substances required for normal metabolism, produced by living organisms and obtained from the diet, necessary for the promotion of growth, health, and life. And these are essential vitamins here. This is Table 8.1 in your book. Please look over these. Vitamin A, the B vitamins, B1, 2, 3, and 6. Folic acid, pantothenic acid, B12, B7. These are physiological effects of major vitamins. If you don't get them, what might happen? Ascorbic acid or vitamin C, vitamin D, vitamin E, and vitamin K. And I misspoke there. These are physiological effects of those actual vitamins that we're looking at here. Those are all physiological effects, and this is Table 8.1 continued. And then these are the vitamin deficiency states. So if you don't have enough A, progressive eye changes occur, degeneration of epithelial cells, beriberi syndrome for vitamin B6, niacin, depression, anorexia, B12, pernicious anemia, vitamin C, scurvy, vitamin D, rickets or osteomalacia in an adult, vitamin E, hemolytic anemias. So please look over the vitamin deficiencies. So in conclusion, the classification of drugs is the orderly grouping of drugs that have similar mechanism of action. Attempting to memorize each individual drug as to its mechanism, indications, contraindications, and precautions is a tedious method of learning drugs. However, by placing drugs in orderly groups as to how they work eliminates much of the repetition in the learning process. It is best to place drugs in their groups or classifications to give them more systematic approach to learning. Very simply, I'll make this as simple as I possibly can on this. 5 years from now, there will be 2 more different calcium channel blockers. But if you understand how the calcium channel blocker works, that it blocks the calcium channels and it dilates out vasomotor centers and it reduces heart rate, understanding that, because 5 years down the road, they may completely come out with a different medication. References for this chapter were taken from Beck's Pharmacology for EMS Provider and Bledsoe's Pre-Hospital Emergency Pharmacology, 7th edition by Prentice Hall. If you have any questions concerning this chapter, feel free to give me a contact or give me a call. My name is Roy Smith, smithr@imsa.net, or 405-219-7613. Thank you.